If you're over 60 and your feet feel numb, burning, or weak, this warning could change how you walk for the rest of your life. Many seniors are quietly dealing with tingling toes, cold feet, sharp electric sensations, or a feeling like you're walking on cotton or gravel. At first, it seems harmless. You shake your feet, you rub them, you tell yourself it's just age. But here's the concern. Surgeons and nerve specialists are seeing more adults over 60 whose neuropathy symptoms are getting worse, not better, year after year. And the most troubling part? Many of them are doing nothing wrong, except one common daily habit that slowly weakens the nerves in the legs and feet. Neuropathy doesn't usually arrive overnight. It creeps in. First, balance feels slightly off. Then, walking long distances becomes tiring. Next, you avoid stairs. Eventually, even standing still feels uncertain. This is how independence quietly slips away. Falls become more likely. Confidence drops, and fear replaces freedom. But there is hope. What many people don't realize is that nerves are not dead wires. Even after 60, even after years of discomfort, nerves can still be gently stimulated, supported, and protected. The problem is not always what you don't do. It's often what you do every single day, without thinking. Long periods of sitting, poor foot activation, shallow circulation, and stiff ankles that stop talking to the brain. Over time, this disconnect tells the nervous system, these nerves are not needed. So the signal weakens. Most seniors are told to just walk more. But walking alone is often not enough, and sometimes not the right answer. What if there were one simple, safe movement, something you could do at home, no equipment, no floor work, that gently wakes up the nerves in your feet and legs? A movement designed not for athletes, but specifically for adults over 60. Surgeons who work with aging patients often say this: when seniors restore communication between the feet and the brain, balance improves first, confidence returns next, and discomfort often becomes easier to manage. This is not about curing anything. It's about giving your nervous system a reason to stay active. In a moment, I'm going to explain what neuropathy really is, in plain, simple language, and why it accelerates after 60 if nothing changes. And then, step by step, I'll show you the one gentle exercise many seniors overlook, yet wish they had started years earlier. Stay with me, because what you are about to learn may help you feel steadier on your feet sooner than you expect. Let's slow this down and make it clear. Neuropathy simply means that nerves are not sending messages as well as they used to. That's all. Nerves are like phone lines. They carry signals from your feet to your brain, and from your brain back to your muscles. When those signals weaken, strange things happen. You may feel numbness, tingling, burning, pins and needles, or a heavy, dead feeling in the feet. For many adults over 60, this shows up first in the toes, then the soles of the feet, then the ankles. Why does it get worse with age? Not because you're broken, not because your body is failing. It's often because the nervous system follows a simple rule: use it or lose it. As we age, we naturally move less. We sit more. We shuffle instead of stepping. We lift our feet less. We stop challenging balance. When that happens, the brain receives fewer signals from the feet. And when signals fade, the brain slowly pays less attention to that area. This is where many seniors make well-intended mistakes. Mistake number 1: assuming numbness is permanent. Many people think, the feeling is gone, so nothing can help. But nerves respond to stimulation, even gentle stimulation, at any age. Mistake number 2. Only focusing on pain instead of function. Pain gets attention. But loss of balance, weak ankles, and slow foot response are often more dangerous. Falls don't come from pain. They come from delayed signals. Mistake number 3. Relying only on walking. Walking is good, but most walking after 60 is slow, flat, and repetitive. It doesn't fully activate the small nerves in the feet. It doesn't challenge ankle control, and it doesn't remind the brain how to adjust quickly. Mistake number 4. Ignoring the ankles. Your ankles are nerve-dense joints. They are packed with sensory receptors that tell your brain where your body is in space. When ankles stiffen, nerve feedback drops. That's when balance fades. Mistake number 5. Sitting for long periods without movement breaks. Long sitting reduces circulation. Reduced circulation means nerves get less oxygen and nutrients. Over time, nerves become sluggish. Now here's the encouraging part. Neuropathy does not mean nerves are useless. It means they are understimulated. Think of it like a dim light, not a burned-out bulb. The goal is not aggressive exercise. The goal is clear communication. Small, controlled movements, repeated daily, done safely. When nerves feel movement, pressure, and gentle stretch, they send signals. When signals return, the brain responds. This is why many specialists emphasize foot-to-brain connection rather than intensity. And this leads us to the most overlooked truth. You don't need 5 exercises. You don't need painful routines. You don't need to push through discomfort. You need one specific movement pattern that wakes up the feet, ankles, and lower legs together. In the next part, I'll walk you through exactly how to do it. Step by step. Slow, safe, chair-friendly, and most importantly, realistic for adults over 60. Now, let's get practical. Everything I'm about to share is gentle, controlled, and designed specifically for adults over 60. Nothing here should cause pain. Nothing should feel forced. And you can stop at any time. The focus is communication, not intensity. Habit 1. The 1 exercise. Seated heel-toe nerve wake-up. This is the movement many seniors overlook, yet it directly stimulates the nerves in the feet, ankles, and lower legs. You can do it in a chair. Step 1. Sit tall in a sturdy chair. Feet flat on the floor. Knees bent comfortably. Step 2. Slowly lift your toes while keeping your heels on the floor. Just a small lift. Hold for 2 seconds. Step 3. Lower the toes. Now gently lift your heels while keeping the toes down. Hold for 2 seconds. Step 4. Lower the heels. That's 1 cycle. Now repeat slowly. Aim for 10-15 smooth cycles. No rushing, no bouncing. Why this works? It pumps circulation to the feet. It moves the ankle joint through safe ranges. It sends clear signals from the feet to the brain. Many seniors notice warmth or awareness returning. That's a good sign. Do this once or twice daily. Habit 2. Ankle circles for sensory awareness. This habit improves nerve feedback and joint mobility. Step 1. Stay seated. Lift 1 foot slightly off the floor. Step 2. Slowly draw a circle with your toes. Make the circle small and controlled. Do 5 circles clockwise, then 5 circles counterclockwise. Step 3. Switch feet. This movement activates nerve endings around the ankle, an area critical for balance. If the circle feels shaky, that's okay. That means the nerves are waking up. Do this once daily. Habit 3. Gentle foot pressure. Reset pressure is information for nerves. This habit reminds the brain where your feet are. Step 1. Sit or stand holding onto a chair. Step 2. Press your feet gently into the floor. Not hard, just firm enough to feel the contact. Hold for 5 seconds. Step 3. Release. Repeat 5 to 8 times. As you press, mentally notice the heels, the balls of the feet, the toes. This mental focus strengthens the nerve-brain loop. Do this daily, especially before walking. Habit 4. Break the sitting cycle. This may be the most important habit of all. Long sitting slows circulation. Slow circulation dulls nerves. Every 30 to 45 minutes, do this. Stand up, march in place gently for 20-30 seconds, or perform 5 heel-toe movements. That's it. These mini movements protect nerves more than one long workout. Consistency beats intensity. Habit 5. Nighttime ankle reset before bed. This calms the nervous system and supports overnight circulation. Step 1. Sit on the bed. Step 2. Extend one leg slightly. Step 3. Point the toes forward gently. Then pull them back toward you. Slow. Controlled. Repeat 8-10 times per foot. This helps reduce stiffness and morning numbness. How to put it all together. You don't need to do everything at once. Here's a simple daily plan. Morning, heel-toe exercise. Afternoon, sitting break. While foot pressure. Evening, ankle circles or nighttime reset. Total time, 5 to 7 minutes a day. That's enough to send a powerful message to your nervous system. These nerves are still needed. Remember, tingling is information. Awareness is progress. Gentle movement is communication. You are not trying to force change. You are inviting it. In the final part, I'll talk directly to you about hope, confidence, and why it's not too late to feel steadier on your feet. If you've made it this far, I want you to hear this clearly. It is not too late. Not at 60. Not at 70. Not even later than that. Your nervous system is not fragile. It is adaptive. It responds to what you do consistently, not what you do perfectly. Many seniors believe the window has closed, that once numbness starts, the story is already written. But that's not how the body works. The brain is always listening. The nerves are always responding, even if the signals are quiet. When you gently move your feet, when you activate your ankles, when you break long sitting, you are sending a powerful message. I'm still using this part of my body. And the body listens. Progress may feel subtle at first. You might notice slight warmth in the feet, better awareness of the floor, a steadier feeling when standing, less hesitation when stepping. These small changes matter. They build confidence. Confidence improves movement. Movement protects independence. This is how momentum starts. You are not trying to fix everything. You are supporting what still works. And that is a winning strategy. Be patient with yourself. Nerves respond slowly, but steadily. They prefer calm repetition over force. 5 minutes a day, done gently, done daily, is far more powerful than one hard effort once a week. And remember this, you are not defined by symptoms. You are defined by what you choose to do next. Each time you lift your toes, each time you press your feet into the floor, each time you stand up instead of staying seated, you are choosing stability over fear. If this message helped you, keep it close. Return to these movements tomorrow, and the next day, and the day after that. Your future balance depends on what you do today, not what happened years ago. Take it slow, stay consistent, and treat your nervous system with patience and respect. You are still capable, you are still adaptable, and you are still in control of more than you think. Thank you for spending this time with me. Take care of your feet. They carry you through life.